Ja, welkom bij Nataraj TV Talk Time. En we have as guest Dr. Anil Mehta, Ayurvedic doctor and director of AGN in The Hague. Welcome in our program, Dr. Anil Mehta.
Thank you very much.
Yes, we are talking about heart disease and vascular disease and Ayurveda. Can you tell something about this?
Yes, indeed, this is a very, very interesting topic. In last year, we have seen that patients are growing like anything. There are so many patients having heart disease. We have to think it why it's happening that much. You see, in Ayurveda, we are convinced that body has capacity to heal itself.
Okay.
You have got certain duties to perform. You have certain food, what you should take, what you should avoid. That's per person different. So if we know what type of person we are dealing with, then he does his duties according to his constitution, things will be little less than what's happening nowadays. To understand, so we have to know what heart is.
Yeah.
You see, heart is a pump. It has to pump blood circulation 24/7. It doesn't stop at all. The moment it will stop, we are no more. So it means the heart is pumping continually for almost 80, 90, 100 years. So therefore, that heart has to be very strong.
Yeah.
Heart has got its own vascular system. He has got his own system to get blood supply through the coronary blood vascular system.
Yeah. Yeah.
So if one way or other, if there is problems, then we get heart diseases. So that is what one thing we understand. So this has to do with important factor of cholesterol.
Yeah. Yeah.
So everybody knows that our body produces cholesterol.
Yeah. Yeah.
Because the bread we eat, fat we eat, and fruits, dals, meat, everything has got one way or other little fat.
Yeah, involved with cholesterol.
Yes. And that fat our liver is converting into the cholesterol.
Yeah.
If our liver is not good enough in its function, if it's not producing enough enzymes, then certainly there is much more cholesterol produced.
Yeah.
So if liver function is well, then that fat taken in the food won't produce that much cholesterol. That we should understand.
Okay.
So it's our digestion power. If digestion power is not good, there is always cholesterol going to be. So we should take little less fats.
Yeah.
We should take adequate dose of fat and right form of the fats. So people used to take animal fats. So meat, this dairy products, these are all saturated fats that produce much more LDL. LDL is low density lipid, it's dangerous fat. You have got second type of fat, that is HDL.
Yeah.
There's high density lipid that is good for our
So
system.
two types, LDL and HDL.
Yes. HDL is good one.
Yeah.
So that heals our blood vessels from inside.
Okay.
We need that. So good fats we need, bad fats we don't need.
Yeah.
So third factor, what don't much people know about, that is triglycerides.
Yeah.
That's very, very low density lipids. It's very, very dangerous.
Yeah.
So people don't talk much about that.
Okay.
So that is the unaware program, unawareness.
Yeah.
So what I'm going to tell you, that cholesterol, if compared with all these fats, cholesterol is okay, but these triglycerides are more fatal.
Yeah.
These are more dangerous for the man.
Yeah. So that's a substance which it's coming from the liver or it's in the blood.
Liver is making that.
Yeah. Yeah.
And if you take that saturated fats, it's going to be more in our blood.
Yeah. Yeah.
So that's going to deposit in our coronary blood vessels.
Yeah.
And that's one of the major cause of having heart attack, heart infarct,
heart disease. Yeah.
heart disease.
Okay.
So that's it.
Yeah. Yeah, Dr. Mehta, so as we talk about Ayurveda and healthy lifestyle. Can you tell something about this?
Yeah, food plays very, very important role.
Mm.
So in Ayurveda, we have got different type of constitutions, Vata, Pitta, Kapha,
Yeah.
and everybody needs different type of food. That's one thing for sure. We have to give that attention to this factor, that not everything is good for everybody. Milk is not good for everyone.
Yeah.
We have to see what type of person he is. And secondly, what very, very important factor is what I'm going to tell, that people got afraid of saturated fats.
Yeah, saturated
That
fat.
is animal fats.
Yeah.
That is dairy products. And they stopped taking that, and they started taking sunflower oil, coconut oil, this and all type of refined oils,
Yeah.
palm oil.
Yeah.
So what I want to tell, that these type of oils are more dangerous
Okay.
in a way, because all these oil have got triglycerides in full dose. So these are full of triglycerides. And I told you earlier that triglycerides are bad, worse than having cholesterol.
Yeah.
So people are not aware of. They buy oils with a label that it has got zero cholesterol. Is okay. Indeed, it has got zero cholesterol, but they are not mentioning that it has got so much triglyceride.
Triglycerides. Yeah.
So that is unawareness.
Okay.
People are not aware of that. So that's what I want to tell them, that oil is also very bad for them. But then still, one thing more what I want to tell them, that oxidized oils are more dangerous. So whensoever you cook oil beyond a certain temperature, that get oxidized.
Yeah.
So like deep frying in the oil, that makes oil more oxidized. So when we take that type of food, what is fried in the oil, that's going to increase our triglycerides, and also oxidized cholesterol we are going to get, and that's very, very bad for heart.
Yeah.
So that one should not be doing. If you want to take oil, then it's okay to just in a pan put a little bit oil, but don't do deep frying in that.
Okay.
So there is one very important message one should understand.
Yeah. So oxidized oil is very, very bad.
Very bad.
And don't use that at all.
Yeah.
And one of the main things regarding also the theme of this program, Ayurveda and heart disease, we look through Ayurveda also at the blood circulation.
Yeah.
And to maintain a good blood circulation, can you tell something about this?
Yeah. Not food can keep you healthy. No. There should be good balance in between food and exercise. Food and our what we do physically with our body.
Yeah.
So people sitting whole day working in the offices, they are more prone to get a lot of disease like diabetes and heart diseases than people those who are doing good sport.
Okay.
So one have to have a little bit time for sport every day.
Okay.
In Ayurveda, we have got different techniques also. Pranayama. Pranayama is breath controlling system. That how to control your breath, how to increase oxygen partial pressure in our body.
On a daily basis.
On daily basis.
Yeah.
So that's what it is all about, having more oxygen or having more oxygen rich blood into our heart.
Okay.
That we have to give. So we have seen the sporters, they are having more capacity. They can get more out of heart. They can they can walk more than people those who don't do any sport. So that way we develop our coronary blood vessels more, because since the birth we have got extra arteries in our heart, and that can be developed.
Okay.
But normally we don't develop that much. We are not aware of that. Sporters, they do.
Yeah.
People, those who are doing much more exercises. So there are possibility. Our body is so perfect.
Yeah.
It's in state to develop itself. But you have to do something.
Yeah.
So Ayurveda offers you a typical program for that. We see per person that how what is his weight, what is his age, what is good for him, what is not good, and how much he can do. It's just developing a condition where he can do little bit more than otherwise. So he should do exercise according to that.
Yeah, you're watching Nataraj TV Talk Time with our guest, Dr. Anil Mehta, Ayurvedic doctor and director of AGN in The Hague. Yeah, welcome back at Nataraj TV Talk Time with our guest, Dr. Anil Mehta, Ayurvedic doctor and director of the AGN Institute, The Hague. Yeah, we are talking about the subject Ayurveda and heart vascular disease. The causes of heart vascular diseases. Can you tell something about this, Dr. Mehta?
Yeah, there are several reasons to get a heart disease. First of all, there is a complication of diabetes.
Okay.
So, diabetic patient, they are overweight. They are prone to get overweight. So, mostly because all that extra sugar is going to deposit in the calories, and calories going to deposit in the weight.
Yeah.
And that is one of the reasons that people get heart disease.
Okay.
Because all that extra fat and calories is going to obstruct the blood vessels.
Yeah.
Second reason is high blood pressure. High blood pressure, we call it sort of silent killer.
Silent killer, yeah.
You see, we have got typical pressure meant for our blood vessels. Our blood vessel, otherwise, they can't have more than 120/80.
Yeah.
Systolic and diastolic.
Yeah.
120
yeah, by
and
measurement.
80
By
by
measurement.
measurement.
Yeah.
So it means that if pressure is more than 120/80, your blood vessels can't afford to have that. That will get damaged with that.
Okay.
If it get damaged, so there's a point where it's damaged. There's a point where everything what is extra that's going to get deposit, and the blood vessel is going to get narrow.
Yeah.
So that way, blood supply to the heart muscle will be decreased, and patient is prone to get heart type of heart diseases.
Yeah. Yeah.
So that's why we must see that blood pressure should not be working as silent killer. So patient go to doctor regularly. He should check his blood pressure, and he should be bit careful about that.
Yeah.
We see in the practice there are a lot of people, they are having blood pressure like 150, 160, 90. They say it's okay. I don't have any headache. I don't feel anything bad about that. But we say that is a silent killer. It's going to damage your blood vessels. Better you do something for that. So lifestyle should be checked. Food should be checked.
Yeah.
So blood pressure should be checked.
Yeah. So as a Ayurvedic practitioner, you see a lot of patients. It's very important to improve your condition. And so can you tell something about the Ayurvedic approach, the treatment?
Yeah, Ayurveda approach, on the very first place, food should be according to the person, what I said.
Yeah.
And person should have good balance in his work and pleasure. We see that last years, and you will see also in daily life, patients, we will be getting a lot of patients with lack of sleep syndrome.
Oh, lack of sleep syndrome, yeah.
Because people are not sleeping enough.
Okay.
A Vata person should sleep 8 to 9 hours.
Okay.
Kapha person needs minimum, that is 6 to 7 hours. And if it's Pitta type of persons, he should sleep at least 7 to 8 hours.
Okay.
So if he is not sleeping well, his mind is not at rest. He will be excited. So this is also a sort of silent killer.
Okay.
So it's going to give him tension. So stress factor will be high in this type of persons. So we should advise him to take a good rest. And not to forget, so his food, it should be on time.
Yeah.
So blood should be thin. We should use this type of herbs in our food. You see, there's garlic.
Yeah.
is a natural blood thinner.
Yeah.
So that's why more in Indian kitchen we use a lot of onions and garlic.
Yeah.
Both are blood thinners, and we should give something what keeps your blood thin also with the quantity of water intake.
Yes. Can you give some examples of, let's say, like Ayurvedic treatment and blood thinner?
Yeah,
You just tell.
I told you that this garlic is good that for, but also drinking enough 1.5 liter to 2 liter of liquid drinks we
Okay.
need per day,
Mhm.
and especially at night.
Okay.
You before going to bed, one should take warm water
Mm-hmm.
or something warm. One should take,
Mm-hmm.
and he should avoid also alcohol because alcohol is dehydrative.
Yeah.
If
Dehydrated.
it takes that water stuff from the blood away,
Mm-hmm.
that way blood will be thicker.
Yeah.
And at night, body is not working, body temperature goes down,
Mm-hmm.
so that thick blood is difficult for the heart to pump.
Okay.
So that's why warm water or warm drinks and after 8 9 o'clock in the evening one should take. That helps to keep your water in the blood for a longer time. And also we need in our food calcium, magnesium.
Magnesium. Yeah. Yeah.
Magnesium that is much more in the spinach.
Yeah.
And not to forget, banana every day is very good for the
Yeah.
patient.
There's certain vegetables, certain fruits
Yeah.
to use.
And this we call antioxidant because antioxidants that you get from the fruits,
Yeah.
fresh fruits, because this is a healer.
Mm.
What we say that if blood vessel is damaged from inside, the epithelial layer is damaged.
Yeah.
Therefore, we need something what antioxidant is. Antioxidant we can get from the fresh fruits.
Okay. Okay.
And this is very, very important that one should take fresh.
Yeah, it's a very good point and very interesting from Ayurvedic point of view. If we look at the patients you're treating with these heart problems or blood circulation problem, diabetes, how does the people feel when they get such a treatment from the Ayurvedic?
Yeah, patients are very happy because I told you in earlier session that we treat person not only physically.
Okay.
Patient should be treated also mentally,
Yeah.
also on the level of spirituality.
Yeah.
So patient can take anything, any good food or good medicines.
Mhm.
If he is mentally not happy, he cannot be healthy at all.
Okay.
So in Ayurveda, we give good attention for social life, that he should be socializing, he should not be alone, sitting at home.
So it's a
He should-
combination of factors.
Yeah, there's a combination of factors. That mind should be happy.
Mm-hmm.
Having good food is not enough. If mind is not happy, then forget it, that you can feel healthy.
Yeah.
So all the factor has to be taken care of. So that family relation, very, very important. He should be doing something for his religion, wheresoever he believes in.
Yeah.
So that gives contentment.
Yeah.
That gives that you are fulfilling your duties. You are doing something what you have learned for.
Yeah.
You should practice your religion. You should practice your whatsoever you believe in.
Yeah, for a good and healthy life.
Yeah. So there is enough. There should be balance in physical, mental, and spiritual.
Okay. Okay.
So that's what Ayurveda adds into it.
Yeah, we are living in a Western society, so the difference between the allopathic approach and the Ayurvedic approach, can you tell something about this?
Yeah, see, mostly in allopathy approach is that they give, they have got fast protocol. They give cholesterol lowering medicine,
Yeah.
beta blockers. They give blood thinner, aspirin, things like that. But there is not that much attention is given for his lifestyle. Not much is for the food what they advises you.
Yeah.
But in Ayurveda gives complete package. We have for them specific type of diet, what to do, what not to do.
Yeah.
and balance in between pleasure and varak. So this makes a really difference for the patient. And patients are very, very happy when they go for all the three ways. So that's why we call it a holistic approach. So not heart is not only heart. Heart is a part of your whole body.
Yeah.
So we have to treat heart, of course, but also mind.
Yeah. So from the holistic point of view.
Oh yes, yes, yes.
Okay. Finally, Dr. Mehta, can you give to the viewers some practical tips from a Ayurvedic point of view to live a healthy and good life?
Yeah. So it's important that one should eat on time.
Mm-hmm.
So you should be having good breakfast.
Okay.
It's very, very important.
From the beginning in the morning?
From the beginning, you should have a proper time before going to school or before going to your office. You should get up early in the morning so that you have enough time so that you can have proper breakfast.
Yeah.
So breakfast is very, very important because last 13, 14 hours you haven't had any food.
Mm-hmm.
So your blood sugar is very low.
Yeah.
And our body functions only in proper blood sugar level.
Yeah.
So Ayurveda believes that good breakfast, and then you should have to have lunch, then evening snacks, before then you have to have dinner.
Yeah.
Then before going to bed, you again take something warm, what I explained.
Mm-hmm.
So it works as a blood thinner, enough fluid in the blood, plasma we call.
Yeah.
So also something sweet should be taken at night. So like dates, figs with warm milk.
Mm-hmm.
It's very good combination.
Yeah.
And do your duties rightly. That is going to give you contentment. And that's also treating yourself. There's a way how you can be happy, healthy, lucky. So if you are content, you are feeling happy from inside. So it's treatment of most of the diseases.
Okay. Thank you very much for your wise words and spreading, let's say, the educational field of Ayurveda. And in the next program, we go further to our following subject.
My pleasure. Thank you very much.
Yeah, you watched the program Nataraj TV Talk Time with our guest, Dr. Anil Mehta, Ayurvedic doctor and director of AGN Institute in Den Haag, the Netherlands. Thank you.